We are talking all about regenerative health. So for those of you who don't really know what that is, we are going to get an education today because we have Erin Keyes here, who is the co-founder of Telegenixx. And Erin, you and I were talking yesterday about, healthcare and how many of us have aging parents and they're kind of falling apart. And I told you, I said, well, I'm not all about just aging and seeing how long I can live. I want to live big, and then I'm cool with like jumping out of an airplane and seeing what happens. You kind of made it sound like, well, maybe you need to reframe that and think of it differently. But what I'm so excited about is in Fuel the Fire, our base tends to be women who are not just out of college, right? They've been at it for a while and they're super driven. They now are at a point when maybe their kids are older or they don't have kids and they're ready to excel.
Yeah.
But their energy, their brain, they have that brain fog going on and they aren't feeling the top, right? And so that's what I love about what you do and what you were talking about yesterday. And so I'm going to let you take it from here and tell us how we can feel at the top of our game to go after those things that we want.
Yes, absolutely. We like to frame it as really optimizing your body and restoring ourselves to a higher state of function. And so today, what I will really chat about is just what is regenerative care as a whole, and then introduce something called peptide therapies. So you might have heard of peptides before, and if you haven't, you will now see them everywhere in food and collagen peptides and skincare and medications as a whole. So just watch out for it. You'll see it everywhere now. I personally am very excited about regenerative health as well as peptides in particular. I think that this is going to be really, what drives our healthcare evolution over the next decade and beyond. So more and more, we'll have to do this conversation regularly so I can keep you updated on all of the evolutions of peptides. But thank
awesome.
you. Yes. Thank you for having me. I'll go over regenerative care, a little bit about the organization. I'm going to share my screen just for a bit, but as Midori was saying, if you have questions throughout the presentation, please feel free to interrupt me. I want this to very much be a conversation. And the majority of it at the end, we'll just talk about, what people are looking for, because as you'll learn, this is a very flexible treatment protocol. So long story short, I am a co-founder and the CEO of Telegenixx. We are a fairly new digital platform, but have been practicing in person in clinics from, Beverly Hills to Boca Raton, Florida to Ohio and beyond for nearly 20 years. So what the revolutionary concept of Telegenics is that everything is digital. So it is through telehealth. We have partnerships with labs throughout the nation. We can send labs to be drawn from your home or office, and medications are shipped to your house. We are available in all 50 states. And the thesis of the organization is that we can extend access to this life-changing care by reducing geographic barriers, but also reducing the financial barriers that typically exist for regenerative care. So getting into that, as I was saying, our mission really is to democratize access. When I say democratize, it's still an expensive tool or service, but historically it's really been reserved for like the very, very wealthy or professional athletes and Hollywood. So I am talking, care from 10 to 100,000 and beyond a year. And that is exclusionary for 99.9% of the population. It's also been reserved for major metropolitan centers like New York, Miami, Los Angeles, et cetera. But it has been around. This is not necessarily a new topic area. What is new about it is layering all the tech interventions and the expertise we've developed over the last 20 years to bring this more into the forefront. Telegenics itself uses peptide therapies. That is a component of regenerative care. You've probably heard of stem cell therapies or PRP and things like that. Peptides are one component of the field of regenerative medicine. Peptides, very simply are just a chain of two or more amino acids that mimic signaling molecules within the body. And so they help restore the function that decreases or degenerates due to age or trauma to really restore us to that higher state of function. Our company, like I was saying, has really optimized this to rely on technology and to improve the operational, we don't just optimize bodies, we optimize our operational workflows too, to make this more accessible and higher access. So our focus areas are, weight loss and body composition. That can include muscle growth, lean body mass, bone mineral density. It can also include targeted fat loss. And so we've gotten very good in our program at reducing fat within the body, particularly visceral fat, that belly fat that both is always frustrating to everyone, but also is the riskiest fat for disease states. And maintaining muscle, because that's a really big part of aging, is assuring that we are holding on to that lean muscle that keeps us mobile for longer. We also offer care for perimenopause. And so, like Midori was saying, for most of us who are not fresh out of college, perimenopause is really difficult to find good information about. Beyond that, it's very difficult to find a practitioner who is well trained in managing menopause. That transition can be very complex, both in terms of hormone management, but also the general changes that our bodies go through during that perimenopausal transition process. So what typically you'll see is an offering for, a supplement set or hormone replacement therapy, something like that. And we can offer all of those, but we like to go above and beyond that and really think through what are the things that set us up for a health span throughout that, midlife and beyond. We have half our life after menopause. How do we make that the best half of our life? And so that is through muscle support, bone mineral density, sleep quality, brain fog reduction, and really just, kind of reversing that chronological time clock a bit to put us into that optimal function. We can also address things like mental performance or anxiety reduction. This one, I actually use this plan, love it. And we'll talk about my personal story in a little bit too. But this one's really interesting to me because it can help regulate what's called brain-derived neurotropic factor, which helps with neuroplasticity. So when we're thinking about how you remember our younger years as these vibrant, creative, zestful years. And sometimes it can be harder to remove ourselves from, the talk tracks that we have or the habits that we have. And adding to neuroplasticity within the brain helps promote creativity, helps promote learning, cognition, memory, all of those things. And I think it's a really nice addition to how we age. And yes, neuroplasticity, it is such a key to life, I think. So we also, of course, offer the classic regenerative care plans, injury and pain. I think just to note here, often we live with pain and we think that's normal. So we'll have pain in our knees and our joints. We wake up in the morning and we're sore and we just think that's what will happen throughout the lifespan. And it doesn't need to be that way. So what we can help do is increase things like collagen production, strength around joints, actually restore the joints in bony tissues themselves to lead to longer pain-free outcomes. And then finally, this is, I think, an emerging use case for peptides. It's getting a lot of attention. We were featured in the Wall Street Journal about this topic area, actually, which was interesting. And that's in the anti-aging and longevity space. So we can address things like cell senescence, cell autophagy. So the things that regulate down to our cells and improve cellular function. We can extend telomere length. We can improve biomarkers for cardiovascular protection or diabetes, improving sleep quality, collagen production, like I was saying. There's a lot of things that we can just restore about the body that limits us as we age.
Wait, Erin, will you define what you mentioned a couple terms in the very beginning of this last segment?
Cell
Um,
senescence, cell autophagy, and telomere, probably.
what is that?
Good question. So our cells, as we do all of our cellular and biological processes, cells have cell autophagy and cell senescence. So cell autophagy is how we clean and regulate our cellular function for replication, repair, regeneration, all of those components. So we can optimize that process. Cell senescence is also when, all of your cells have a turnover point. And so at some point, you really do have to help the body move through that full cellular life cycle to drive that peak performance. And then telomere length is actually an interesting one because for many years, we thought that telomeres were the limiting factors for lifespan or disease state. It's uncertain the exact relationship between telomeres and longevity. But for a lot of people, kind of focus on maintaining that length is important. Really, as your cells replicate and divide, the telomere length division over division shortens. And so we can reduce that shortening. More will be learned in the field of how that impacts the body. But we do know when we're younger, telomeres are longer. When we're older, telomeres are shorter. And there's some theories around what that causes in terms of diseases, whether that's, cancer or otherwise. Yes, lots of fun molecular biology terms that I have to pull out of my brain from college. So, good thing I'm doing the mental performance plan over here.
There you go. Thank you for explaining that.
Yes, thank you for asking. So yes, all of this packaged together, really what we like to frame this as is an intentional and preventive attempt to restore ourselves to a higher state of health and create a preventive plan that puts us on a good path for the rest of our lives. We also, of course, want to encourage lifestyle changes as well. So we're, all of these things are multipliers of the hard work we all do day in and day out to regulate our sleep, to exercise and train in the gym, to go on walks, marvel at nature, eat well, all of those things. We like to view these as multipliers so that it gives us some room to really invest that effort and see better results without demanding unreasonable characteristics from ourselves. So through that, just kind of really briefly over this, and this kind of goes back to the definitions in a more structured way. What we like to see is that you repair, refresh, and regenerate your body, your cell, your tissues in between. So this branch of medicine really is always looking at new treatments that can evolve how we manage our bodies and care for them. We like to do this to restore optimal function, whether that's through, your lab results, your disease states, but frankly, just to improve the quality of our lives, to let us lead more joyful and vibrant and energetic lives without suffering through a number of the things that really do limit our ability to enjoy this life. And so at the end of the day, really, we're focused on cellular medicine. We're starting really, really small. We're starting with cellular signaling, and we let the body do what it's good at. We don't even frame often peptides as medicine because your body has it. Your body knows what to do with it. It's good data and information for your cells to fulfill the mission that they're here for. So with all of that, the core components of reducing inflammation, improving our body composition, deepening our sleep, improving immune function, those are the types of basic outcomes that we can get that bubble up into those care plans that we talked about. Weight loss, body composition as a whole, quality of skin, those types of aesthetic or measurable outcomes. So all of that starts with the cells. I won't go through this necessarily, but really what this slide intends to say, and then I'll, kind of move into conversation, is like I had mentioned, this field has been around a while and it's been very difficult to access. Cost, geography, of course, but there's also just a decentralized, almost DIY style of regenerative and preventive care, where it sits on us as a patient to find the types of services that we want. What we intend to do with the platform, which is continually growing, is to help people find quality assured and effective or certain outcomes within the practice. So we aren't going to ask patients to check the quality of the care plan, to check the medications, to check the quality of their physicians. We are the ones that really vet and do that for you with a team of medical advisors, strategic advisors, scientific advisors, et cetera, who we've all put our heads together to really pick through the highest quality, the most interesting and innovative care plans to deliver that to a patient population that needs that lift. Our medical advisory board is amazing. So we have Dr. William Seeds. I always describe him as the guru of peptides. He is a global researcher. He is, the doctor on consult for all of the professional sports leagues, Dancing with the Stars, pretty sure all of Hollywood at this point, and a number of really rare disease cases as well. So he balances his patient panel of very high need health risks and disease states, and people that are just interested in leading a preventive and regenerative care path forward. He founded a training institute for physicians to assure that they are literate in this type of care. We're seeing an explosion of interest, but not all physicians are trained on how to do this. There's not a residency program in a regenerative care. So Doc made one. And through that training program, we have access to those top quality physicians that have been trained in all the protocols, trained with all of the research and data that we have, and then connected to those high quality components that we offer. Dr. Betsy Yurth, she's another amazing physician. She founded Boulder Longevity Institute. We were joking. She gets referrals often from Mayo Clinic, where they'll, do whatever they can. They have a regenerative care arm. And they're like, you know what? We have reached the end of what we're capable of doing. We're going to give you to Betsy. So that's, I don't think there's a better compliment in medicine than something like that. So she is, again, another fantastic researcher. She does really interesting work, whether that is for Ironman competitions, to really think through that precise optimization at that level, through, again, very rare and traumatic disease states and everything in between. Dr. Chris, he is the funniest and most accessible physician I think I have ever met. He really does a fantastic job of blending what I think of as this middle ground between healthcare and wellness. And so oftentimes people will go to research clinic in an effort to improve, how they look and feel. And they walk away with an amazing and improved health profile that will stay with them for years. And so we often say, I don't care why you're starting this. Maybe it is to lose weight for the summer. Maybe it is because, we're seeing some fine lines and we don't want to see them anymore. That is great. Maybe you're coming in because your cholesterol is high or you're diabetic. Both of those are fantastic, very valid entry points. And we love that you are taking initiative on your health and setting yourself up for the future. And I think that's really it. I'm happy to go through any of these care plans more specifically, but I imagine, if you want to learn more about this, get with me one-on-one. But, overall, there's just a lot of specific outcomes that we really can drive to with each of the care platforms throughout all of these. And at the end of the day, I think it's very rare that I get to be in a win-win scenario such as this, where, there are millions of people suffering. Some are suffering in a very extreme way. Some are just, having a low level pain, discomfort, whatever it might be. And we can help drive towards those safe, effective, and truly life-changing treatment options. I was in a discussion yesterday. I'll stop sharing for a bit. And we were talking about what does it mean to have body confidence? And it was everything from, I can walk into my closet and feel really good about any outfit that I pull out of there. It could be a bathing suit on vacation. My example is that it's very comfortable to cross my legs. Like, that is a very daily functional thing. We had a patient, a guy in his 40s, always been fit, was a new dad. So things, change for him. And he walked away and he's like, A plus, 10 out of 10. Guys, I can bend over and tie my shoe with ease. I'm like, that is a very specific recommendation and I love it. So it's little things like that where, it's not so much these before and after grand transformations. It's all these millions of little ways that our days get better, day over day over day. And so that's really the intent of the platform as a whole. I was thinking that I would, kind of pause and see if there's any questions on anything that I probably confused everyone with in terms of terminology, but then also how to leverage this into your daily life and your work environment. So pause for any questions, rumors you've heard, thoughts, issues, any of that.
I know. So we have Sally on here. She is remote right now, but she is a huge triathlete.
Amazing.
Yeah. Sally, are you there?
Yes, I am. I'm listening. Yes.
Yeah. So you heard Erin talk about how they're working with the NFL and other pro teams about, how do you repair yourself? Because you included and all your clients, you guys beat yourselves up. You're in great shape, but yeah. So do you have any questions for Erin or?
Yeah, I'm trying to understand, is it a supplementation program? I know as an athlete, I do all kinds of supplements to help with rebuilding and also to help with my immune system, but it's a big guessing game. I don't really know what I'm doing. So I know it helps me feel better. Yeah.
The guessing game. We want to remove that uncertainty and experimentation. Yeah. Ours, so we offer a number of types of services. Peptides in particular are our primary focus. And those are in a number of formats. They can be injection based and self-administered through an insulin needle, same as a type 1 diabetic kind of thing or type 2 diabetic that takes insulin out of the syringe and vial. We can coach any individual on how to do that. We also have nose sprays, and then we have tablets or pills and some creams as well. And how we choose the format is what is the most effective way to meet your specific goal as you as a patient, to drive those outcomes. And so that's really kind of managed by the scientific and clinical team to meet your personal needs. But what I think you mentioned that's really interesting to me, there's a peptide that helps modulate growth hormone secretion. And so when we think about our younger years, and how easy it is to build muscle and how we don't, retain fat, how, people joke about hangovers and how, you hit 25, 30, something like that, and you learn about a multi-day hangover. It's simply, your body's inability to recover. And that shows up in fitness also. So what we can do with growth hormone regulation is improve, again, that collagen secretion that is a good component of muscles, bones, ligaments, tendons, all of that drives or reduces the soreness that we'll feel when you beat yourself up from the triathlon. It can also improve your energy balance. So we can improve things like mitochondrial energy, and that lets you work out harder. It lets your muscles recover more quickly, can drive endurance, can drive muscle growth, my favorite part of it actually is it's, not muscle building in the way that someone, often thinks of where you get bulky. It's more the stabilizer muscles. So I always, joke, I got very excited. I found the little like bodybuilder, tiny little muscles in your legs, in your thighs. And I saw those. I'm like, look at me go. And so I've been an athlete my whole life, and I'd still never been able to get to that level of kind of core muscle function. And so it helps your body really regenerate and perform at that optimal way. In addition to that, it helps with things like sleep wake cycles. So when you get that deep wave sleep, it helps restore and repair the body. And after a workout, that's the most critical thing you can get. So that's often, kind of what people and patients notice first. Like, wow, my sleep has vastly improved, and that set me up for success on everything else. But yeah, the recovery piece.
Nice.
Yeah.
And then I have another question. So the program, is it set up where you pay by year or you pay monthly? And do they do Okay.
Yep. And it's
then,
all inclusive of everything. So
okay.
we really believe in that personalization aspect that I was talking about. And so to do that, we're just going to, roll it all in to one transparent price. And so if you sign up for a plan that includes all the physician visits, we do on-demand physician visits to just help you throughout your process, really optimize that. So you will be assigned to a physician. They have a clinical support team of nurse practitioners. You have on-demand access to them, all your laboratory tests that are needed, and those help personalize the program itself. All the medication is included. Access to the application for learning and information and things like that as well. Over time, we seek to create a community standpoint, so people that are going through similar health experiences can kind of talk through and do some community building within it. We've seen an amazing outcome from that. Even, our perimenopause program, we're doing a weight loss focused at the, perimenopausal years, and having the community around that's been really helpful, because people have a lot of shame on a lot of this stuff, whether that is a chronic injury or weight gain, or the brain fog's a big one. We have a lot of shame in our health, and we want to remove that barrier. This is not a blame or a shame game. It's very cool that people are thinking through their health preventively, and we want to create a community around that good feeling.
So Erin, I want to ask you, you hit on the brain fog thing. Is this something that helps, that's preventative care from Alzheimer's, dementia? Is there any correlation there, or does what you do, is it more based on the natural decline, mental decline that many of us go through?
This is such a good question. So it's actually both. We have, there's many peptides out there. There's hundreds or thousands of them, and we're discovering new ones all the time in the body. And so again, talk to me next week and I'll probably have a whole other list for you. But one thing that has been really interesting is the very trendy semaglutide, which is equivalent to Ozempic, Wegovy, and the weight loss drugs. That semaglutide at very low dose is in not very low dose, at low dose, is in stage 4 clinical trials for Alzheimer's prevention. It also is being used for things like irritable bowel syndrome treatment. And so there are a number of diverse use cases that, again, when we, really optimize our cellular signaling, that cascades throughout the whole body. And so I think what we're learning more and more is that the connection between the brain and the gut is very strong. We often in our team kind of refer to the gut as the second brain. And so when we can really address that nutrient digestion process, it upregulates a lot of the other things that are going on in our bodies and restores or prevents some of that natural degradation. In terms of the brain fog piece in particular, the neuroplasticity, that part is huge. The other thing that I think is really critical about the peptides that we use to focus on brain fog and improving mental performance, they reduce inflammation in the brain. And so we are often told that there's not an immune response in the brain, which is actually untrue. There's something called microglial cells that do the immune function. My brother's an MD PhD and studies that. So if you want to go nerdily deep into that, I'm not your person, but I can find you a guy that is. But, with that response, we do get this kind of chronic inflammation in the brain. What you'll see from something like an SSRI for treatment for anxiety, depression, or well-being overall is that will increase neurotransmitter output to cascade through the brain. What we can see as well is when you reduce that inflammation in the brain and help with the metabolism of things like dopamine and serotonin and other neurotransmitters, it has, fairly equivalent effects. And or can multiply the effects of SSRIs. So with that, inflammation, we learn more and more, is often a cause of disease or an alignment with disease. And by reducing that in the brain, that is really a preventive focus for Alzheimer's, for other degradation, but honestly, just the the burden of, aging is unkind and it can be undignified, and helping to slow that process really maintain some of that health stance and performance that we want to have over the years. So yes, both. There's some active prevention and some active treatment of things as we move through those cycles.
Okay, that was super helpful. Stacey, Go ahead. You can unmute. I know you have some questions.
I can read them if that's easier for you too.
Oh no, this is really exciting. I love this kind of stuff. So I'm really excited. And I've recently going through perimenopause and learning and figuring out the gut biome and dealing with anxiety. And I've just recently started working with a functional medicine practitioner or doctor. So I've done labs and done blood work and everything you said. It's really hard to find a doctor who kind of knows about menopause and those kind of things. So I was just my question is, how is this different from like functional medicine and biohacking? And then when you talked a lot about peptides, so this is the first, I know I'm familiar with them. I'm just curious, are you selling a product or are you selling a whole program? Or you mentioned,
what are we doing more specifically? Yeah, good question. It's not at its core really different than functional medicine. I think what we're seeing, so my personal understanding and opinion of this, right now we don't recognize aging as a disease, which it's not. But what that does in our healthcare system is that our things like residency programs, training programs, even our medical billing is rooted in diseases. And so when we don't recognize aging as a disease, we really can't focus on that prevention piece for a number of other components. So functional medicine docs really at their core are trying to be, this connecting piece between traditional healthcare representatives to drive that like whole health picture. We equivalently try to do that by driving the whole health picture and leading to that preventive care behavior. But we're very focused on those defined core plans. So I'd say that's where we're different. You might recognize us as like a functional medicine doc that really focuses on longevity or, mental performance. So a specialist in that way, for example. Functional medicine or regenerative medicine, oftentimes if you walk in, they will do a whole health picture and then pull multiple things together, which can incrementally lead to a number of outcomes. That is great. I think our philosophy is really more focused on, as humans, we're goal-oriented and driven. So let's define what your primary goal is, achieve that with you, and move you through that whole complex kind of customized program. As opposed to just throwing a bunch of things at you and like probably it's going to work, but we don't know where and when and why. And so ours is a bit more kind of rooted in that scientific method. In terms of biohacking, I go back and forth on if we are adjacent to biohacking. I think my understanding of biohacking is that it is a very involved process and focuses on really kind of that like last mile of health. And so I'm in a bunch of biohacking communities just out of interest with peptides and some overlap in supplementation there. And, the regimens that individuals post, it's like at 7 a.m., I eat all of these 28 supplements. At 7:03 a.m., I eat all of these other 40. And ours is not that complex. We have done a lot of research to really figure out what are the effective and certain outcomes or methods to get the outcomes we want. And then we focus on simplifying to get us there. I think a lot of us really are trying to do the last 20% of the work with 80% of our effort. Well, let me reverse that. We're trying to, we want to put in 20% effort to get that 80% outcome. And what we ultimately do is a big amount of effort, that 80% effort to have a 20% change. And so Telegenics wants to reverse that. So you put in, 20% additional effort, you get 80% of the way there. And then we can worry about the details. Once you're already feeling good, you're motivated, we've earned your trust, all of those components. Yeah. And so that is a whole body program. We also offer primary care and just regular medicine as well. So if you are coming in with a thyroid condition or, perimenopause and all of the things that can create for you, we can manage that whole health picture. But we do the care programs to really drive those goals as well.
Got it. Okay.
Yeah.
Did I answer all your questions, Stacey?
It did. Thank you.
Okay.
Excellent. So the other thing I talked to Midori about yesterday as well is really thinking through the visualization activities of how your health affects both your day-to-day life now, but also what we want to do in the future. And so, the crossing your legs example or tying your shoes examples is a little one of how your health shows up in your day-to-day life. But I often think about how until we find relief in some of the things that we're carrying, we actually do not know how we are atypical. And I think mental performance and anxiety is a big one for that, particularly in a work environment, particularly as women. But, maybe not even just as women. I think everyone kind of goes through this, where if we are in a scenario and someone says a comment, how we interpret that comment is often different than how someone is intending to share it. And so one of the things that we, try and think through in the regenerative care space is how do we get that equity in emotional response and reaction? So when we put someone at the front of the room in the boardroom, when we put a woman in an executive role, but she's still carrying some of that anxiety and trauma of the life story, that's a very big ask of that person. And so how do we help reduce just that general allostatic load as we come in and set people up for a mind state that leads them to healthier outcomes across all components of their life? So that might be, of course, lab values or, your cholesterol. It might be your eating habits, but it also might be in driving the emotional reactions that you have when you put yourself in challenging positions or exist in a challenging world, as we all do. And setting up these habits, narratives, and spaces so that we give ourselves room to react and grow into that person that we see ourselves as in the future. And so I think that that's where this difference between optimization and treatment of disease really does come up. I think a lot of us we're not seeking normal. We're not seeking average. We are seeking a great life and whatever that great life means to us. And so I think that's something that we really want to talk through. And then carrying that forward. So like Midori and I were talking about yesterday, when we think about the last 10 years of our lives, whenever that is, whether that's our 70s, our 80s, our 120s, whenever it is, what do we want to be doing in that? And, I think we want in general, chasing our grandkids, hiking the Himalayas, et cetera. How do we start now to make sure that in that last decade, we're feeling good and we have the strength, the flexibility, the mind state, all of that to get us there. And so that's just kind of the framing I think about for a lot of this. But I am actually curious on, from everyone, what are those little things day to day, whether that's in a work environment, at home, that kind of throw you off, that it's a part of life that we've just accepted? I think perimenopause is a great example of this, where it's like, I just have to, this is life. I just have to deal with it. But what are those little things, and how can I help us all kind of optimize each of our own stories?
Well, that's a fun question.
Yeah.
Stacey, do you, or Sally, I don't know, Sally can jump on, but do you have something that you want to mention here?
Oh gosh, I mean, where do you start, right?
I mean, I think of you were talking about the mental game, which I didn't expect you to talk about, Erin, and the way that we approach it, right? Because just like you said, all the women in Fuel the Fire, we're not there to play small. We're there because we want more and we want control of our lives. That's why women come in to Fuel the Fire. But I hear similar narratives. right?
Yeah.
Where they want these big things, but, and it's always about this, what's
Limiting
that?
beliefs.
The limiting beliefs. I'm not able, I'm too old, I'm too young, I'm, whatever it is. And I just see that consistently.
Yep.
So how do you talked about mindset, but can we take a pill to fix that? Because that would be great.
Yes. Well, you can take a nose spray.
Okay. Who knew?
It's not, one unilateral fix for it, but I think what I like about the medication, as I mentioned, I do use this one. It has helped me with energy and consistency. And I think I actually was in many ways nervous about that, because when I'm overtired or overstimulated, I can see myself losing the quality of work. And this helps me stay on the straight and narrow for that. So that's huge. I also have a 2-year-old, so that doesn't help. I need all the help I can get. But what the peptides can do is, of course, regulate that energy, give you more consistency, but it's almost like it gives you this moment of pause before reaction. And so if someone says a comment, or you step into something that you feel vulnerability or you feel nerves around, it will separate you a little bit from saying, is it my identity that I am a low performer? Or is it that I am able to do this? I have to take a pause and a breath, and I'm going to commit to it. And so having that moment of pause before we put ourselves in that negative spiral, I think is really critical in putting us in that mind state to make those good decisions. And that's a pretty easy one. There's not a lot of, it's not hard to administer with the nose spray. It's like Flonase. It's very subtle. It's not going to change your personality.
Is this like a PT, like something they use for hyperactivity type of thing?
It's mostly anxiety reduction. There's also an option for depressive symptoms as well. And then interestingly, we have another one going back to the gut-brain barrier that helps with intestinal processing. And so it's funny to me that, kind of when you clean yourself out digestively, it also cleans your brain out a little, which is always kind of fun. And so, yeah, it's just really sort of helps you to have more control over your brain responses and your brain management.
That's awesome. Okay. So Sally is wondering, she's been a triathlete for years and years. And so she had neck surgery, less than a year ago, I think. And so now she's talking about, I don't know if you're seeing her questions, but she might have to have another one. And then needing energy and health to grow our business. So, those are big ones. And I think this is something that it's not an if, it's a when for many of us, whether it's a big surgery, a little surgery, or some type of health question. And that recovery piece as we age just gets more and more challenging. We actually have a whole program for injury repair. And I think, my critical feedback of our traditional healthcare landscape is that we have amazing surgeons, whether that's orthopedic surgeon, general surgeon, whatever it might be. We have amazing physical therapists, but there's no connection between the two where we seek to put that joint or that site of injury into a state where it can repair itself. And that's where we would come in. And so we have peptides, most of them are injections that do help create the tissue that supports and regenerates the site of injury itself. This is, hot off the press. We're applying for grants to do this with the military because, it can drive that recovery process and just really get us back into that peak performance, reduce re-injury, reduce the pain and suffering, and get us just back into our lives a lot more quickly. Healing the cells. It helps even vascularize the area. So getting oxygen and the nutrients that we need to the site of repair. And we can do that. We actually are working with a few surgeons to support their patients at post-surgery. And so more to come on that. But yeah, that's a huge one, Sally. And the sleep regulation piece, I think you're talking about sort of separate issues that roll in together. If you're not sleeping well because of pain, or you're not sleeping well for another reason, it leads to longer pain and discomfort. It's this vicious cycle.
I do use a peptide, the same one that helps with the collagen to reduce fine lines and help my hair grow. Fantastic as a new parent in many, many ways, even skin tightening. I love it. But it also really does help get to those deep wave sleeps. So if you have something like an Aura ring or a Whoop or something like that, it's really funny to watch those measures, because it's like you drop off in a cliff. It's like, okay, I'm going to bed and now I'm going to the restorative sleep. And I will be there for 8 hours. I will call you in the morning. And so it can help really kind of put your brain back into that space. And I think that's another thing, again, with, perimenopause and all of the hormone surges, we all do the best that we can to optimize, whether that's eating, exercise, et cetera. We have such limited control on the quality of sleep we're getting. And that is such a strong piece of our overall health picture. Yeah, the levels is another interesting one, Stacey. She's saying getting an Aura ring and levels. And I also wear a continuous glucose monitor. I have type 1 diabetes, so I've had this for years, and that is one of the most pronounced outcomes. I did our weight loss plan. I do our anti-aging program now, as well as the mental clarity. And for the weight loss plan, I was, probably chubby, but I was never someone that was dealing with obesity or anything honestly along those lines. And so for me, doing the weight loss program helped balance my insulin levels. That put me on just a complete different path towards health. It reduced my, I'll always inject insulin because of type 1 diabetes, cut that by over half. And that affected so much to me. Your metabolism is very complex. Your digestive system is very complex, and reconciling that insulin piece and the blood sugar component reduces inflammation, reduces digestive discomfort, reduces some of the brain fog with the spike in sugars. But it also teaches us what foods work for us and what don't in many ways. And so I think that one's I love the data. Levels and Aura ring, it's like, tell me something about myself I don't already know, and I will love you forever. And I feel like both of those companies do that, which is very cool. And then was there another question? Focus and being able to stay on track. The ADHD is an entrepreneur thing. I think it's one of those scenarios. I also struggle with this. Because it's one of those superpowers that if you can leverage it, like ADHD, I feel like is an adaptation. If it is, taking you away from the function you're here to perform, it can be really, really detrimental. And so how do we get us to a state where we can exist in this complex and chaotic world and improve and drive our own productivity? And I think, kind of going back to that separation, that pause in that moment of, oh, I have all of these things what is my priority list? Let me have these practices to, time box my day, but also give my brain the clarity and the focus and the prioritization to keep myself moving through my list, even though I have all of this other stuff going. And that moment of pause, it's like a mild tranquility. It reminds me of like Zen and Buddhism and what we seek with that tranquility piece. How do we give ourselves that, kind of fighting chance within the brain? That one's huge. And mix of biology and chemistry and environment and epigenetics and genetics, all of that rolled into one. But
Erin, can you talk a little bit more about that as far as when someone starts, let's say they have ADHD, right? And they've had it forever, or maybe they didn't know they did. And most of us, right? I mean, entrepreneurs, that's kind of, it goes hand in hand. That's why we're so creative.
Yes.
And I loved yesterday when I was talking to you, you're like, I want all of this now.
Yes.
Like, I need to move fast. And I think a lot of us feel like that. And that's part of the ADHD. So I think we all are in the same boat.
Yeah.
But so when someone comes to you and they, you decide on the path of treatment, whatever it may be, but to help specifically with getting focused and helping you get control of the ADHD so it's working towards you, how quickly and what is kind of the things that people will notice once they begin treatment? What's the, kind of give me the before and the after of what it looks like.
Yep. It really does depend on the individual, because there's a lot of things that go into that. So for some of us, it really is, we're overwhelmed, and it can help us get the clarity to dig ourselves out of that hole. And so that one, generally it builds where we'll, maybe take a peptide. It can help put us on a good path, for the immediate behaviors. And then you dig yourself out of that hole, and it multiplies. Both, your brain continues to heal and restore, but also our lives continue to heal and restore. And so I think it, same with eating and exercise. The better we feel, the harder work we put in, which leads to feeling better, looking better, which increases motivation, which increases commitment. And, it just builds in that way, and this multifactorial component. So there's that piece. For some of us, we have, very acute reasons why we are distracted or balancing a lot in the brain. Again, like the sleep component is often huge. And so that's generally the first thing people notice is like, for the last 20 years, and this is actually my story too. I woke up kind of dreading morning because I was still tired and I didn't want to wake up. And so my alarm would go off and I'd be like, 5 more minutes. And when you can actually restore the quality of sleep into that deeper sleep and give ourselves that more balanced energy, I wake up in the morning usually to a screaming toddler, and I'm like, all right, we're here to go. What are we solving today? And so I'd say the before and after, we could do afters at like every 6 months or something, but that quality of sleep, the stability of energy source. So maintaining that kind of energy baseline, and then giving ourselves, that calmness, the more balanced decision-making power, I'd say, are the number one things people really notice out of that. And the balanced decision power, maybe that's a poor description. Oftentimes it's truly like reduced anxiety. Increased curiosity is a big one, or openness, where it's sort of like, might as well try. I believe in myself that I can do it because I feel empowered to do it. And so that's what we'll see out of a lot of people. They just feel like they think more clearly, they have more energy, they're excited about things again, thinking of them in a more creative way that leads to better outcomes down the line.
I know.
And all starts with sleep. It truly all
sleep
starts
is huge. Yeah, both of us nodded, right? Stacey is like, we get it. Yeah. I know, like, I do this 21-day cleanse. I usually do it once a year. And by day 14, 15, I'm totally a different woman. I have clarity. I am like, oh my gosh, I can do this and I can do that. And it's as though someone injected me with something, like where all of a sudden I can feel my brain cells just connecting, and I feel so like I can do anything.
Yep.
But then, it lasts for a couple of weeks or even a month. And I eat healthy and I work out on a regular basis, but I don't have that level.
Yeah.
Is this kind of what you're saying? Is that we can feel where we're at that optimized level on a regular basis when we have the right, I don't know, I'm not positive what a peptide is yet, but with the right treatment. Is that kind of what you're saying?
Yep. Basically, peptides are the building blocks of proteins, and all of us are, made of proteins. Everything is at some point connected to a protein. And so really what we think about for peptides is that they magnify a lot of that good work, or they kind of increase that basic level. And so what you're getting to in your cleanse is probably going back to that cell autophagy and cell senescence. Your body's working really, really hard to get there. And what we can do is just restore some of the signaling molecules that drive your body to do what it's already trying to do. And we often get in the way of what our body is trying to do ourselves. And so this just helps us kind of break through and give the body the tools to make the decisions and move forward and protect ourselves in the way it knows how to do already.
Oh my gosh. obviously, Erin, we can go on, and I'm so glad. Stacy, Erin is in Fuel the Fire, so you can find her, right?
Yes.
But
yes.
for everyone else who's listening, we have a lot of people who are going to be listening to this later. Where can we find out about you? What's your website? How can we reach you?
Yes. So you can go through www.telegenixx.com. There's 2 X's in Telegenixx. So that's our website. On the website, you can actually subscribe and we'll reach out to you, or you can book a consultation. And in the consultation, that's where we can talk about the personalization of it. I do a lot of our initial consultations. We'll do those before someone signs up. And then we have a few other experts that will also talk to and counsel individuals as well, depending on what the area of specialty is. But I would say, reach out to me on the website, support@telegenixx.com. You can DM us on Instagram or Facebook. All of it, can kind of get to me or from me to the experts to really answer any question. But yes, if anyone's interested or wants a referral or a custom plan, any of that, we have it all.
Awesome. Thank you so much for sharing all this information with us, because I didn't know about it. Most of the people I know are not. We've heard little rumors about this whole regenerative thing, but we really don't know what it is. So
exactly. I think it's going to explode. We're seeing the interest just exponentially grow. And what I'm most excited about is bringing this from something that's just been reserved for such a small group, whether that's the Kardashians or the, high performance athlete, and really giving people access to that, because, it helps us feel better. It helps us look better. It helps us perform better. It helps us break through our own barriers, self-created and environmentally. And I can't think of a better job than helping people discover the them that they want to be, So.
Oh, that's a great way to end this. That's awesome. Discover the them that they want to be. That's awesome.
Yeah.
Well, thank you so much, Erin. And
thank you for having me.
Yes.
Thank you, Erin.